And then we'll call some of your witnesses from the Department of Corrections.
Yep, thank you, I appreciate it. And I have an expert witness who's also testifying, and they're marked as an expert for this bill as well.
Great, so we'll put yours in play and get some of these people going, and then we'll start with the people who are testifying on many bills.
Fantastic. Thank you, Vice Chair McEntee. Thank you, members of the committee, for listening to this bill, and everyone who has come out in support and has been waiting for so many hours to be able to make their voices heard. So this bill, the Restrictive Housing Act, or restrictive housing, also known as solitary confinement, is the act of keeping a person in a cell for 22 to 23 hours a day with no meaningful access to other people. Research shows that prolonged isolation in restrictive housing has been linked to multiple mental health impacts, including increased anxiety, depression, paranoia, aggression, and hallucinations. The rate of self-harm amongst folks who have been in restrictive housing is 10 times that of those in the general population. They also have higher rates of PTSD, diagnosis of suicidal isolation than their peers in the general population. Dozens of studies have been conducted in terms of the impact that restrictive housing can have in an individual. And it finds that these practices of holding someone in restrictive housing, even if it's 1 day, even if it's 2 days, is cruel, unhealthy, expensive, and counterproductive. It doesn't keep us safer. It does not help in terms of the person's behavior to try to make things better, does not promote efficiency in any way, shape, or form, according to those researchers. In 2016 and 2017, the state put together the Special Legislative Commission to study solitary confinement. And they heard testimony from medical experts that prolonged isolation causes high rates of psychiatric hospitalization, sleeplessness, and like I said, anxiety and other issues. The commission made several recommendations in terms of how to reform restrictive housing in Rhode Island, and this included things like increasing out-of-cell time to 4 hours instead of the 1 hour. It included things like excluding folks from vulnerable populations, increasing access to programming and family in particular, limiting disciplinary confinement to 15 days, and so on and so forth. The Rhode Island Department of Corrections, or RIDOC, claims that these changes that are sought in this bill in the Restrictive Housing Act are, quote, impractical, dangerous, and contrary to the best correctional practices, unquote. However, states that have reformed restrictive housing saw cost savings, saw safer facilities, and lower rates of recidivism among those who have been incarcerated. Safety data available of those 11 states that have reduced solitary confinement, and just for the record, I'll name those states: Mississippi, Ohio, Arizona, Virginia, Maine, Texas, Washington, North Dakota, Colorado, Oregon, and South Dakota are some of those states. 9 of the 11 states that I mentioned saw decreased rates of violence, and the other 2 no increases of violence once they implemented these reforms. If these states have successfully amended or substantially amended their use of restrictive housing, so can we. These are correctional best practices. We have research that shows that. They have implemented the reforms, and again, I know Rhode Island is a bit not very open to always just doing the right thing, but this is something that we can do to make things right. This legislation will bring Rhode Island into compliance with national and international standards and best practices through common sense reforms known to make prisons safer, keep people safer and healthier, reduce recidivism, and save money by moving prisoners to less restrictive housing settings. It would require DOC to provide incarcerated people with the tools and supports that they need to transition into and successfully into the general population, which should be the ultimate goal of the DOC. It would also improve access to medical and mental health services for prisoners, programming and education, and so on and so forth. We understand that there are situations where restrictive housing is important and it's maybe necessary. And no one is saying otherwise. No one is standing here and saying that it's not necessary in some instances, right? We give deference. However, it's important to create parameters that will ensure that prisoners' safety and well-being. Because the time that is spent in restricting housing, again, has detrimental consequences to those folks. And without parameters, I should also mention, it leaves room for abuse. And for example, there's currently federal legislation against the DOC regarding alleged abuse of an inmate who spent almost 8 months in solitary. There's in 2019, a class action lawsuit that charges DOC with inhumane constitutional violations against prisoners with mental illness. So you can't tell me that it doesn't happen. I commend the DOC because following the commission's report and the recommendations, they have implemented some changes. But those changes are policy-based, right? They're not legislatively, which means that tomorrow a new member, a new director, or a new whomever may come to the DOC and decide that these changes are no longer warranted and the resources could be used elsewhere. So they are not permanent. This legislation seeks to make changes permanent. So that's one point in terms of their comments. With additional changes, we can really bring Rhode Island into the fold of states that have made positive, significant changes to their restrictive housing to make it better for folks. We can ensure people's safety, their well-being, and I really hope that the committee and the members really take this serious in terms of really trying to figure out how can we address this issue and work together to be able to pass a legislation that is meaningful and helpful to our communities. Thank you.
Thank you, Representative. Any questions of the sponsor? Seeing none, we'll start with the first witness. That's Natalia Friedlander. And next will be Patricia Coyne-Faig. Is she here? Oh, good. And after that is Lynn Corey. Natalia, please proceed.
Hi, thank you, Vice Chair. Thank you, honorable members of the committee and Representative Felix for sponsoring this important piece of legislation. My name is Natalia Friedlander. I'm an attorney at the Rhode Island Center for Justice. You heard Jen Wood speak previously about the wage theft issue. I've been working for 7 years advocating for and representing individuals in Massachusetts, Connecticut, and Rhode Island who've experienced prolonged solitary confinement, including a number of individuals here in Rhode Island who've been subjected to months and even years of solitary confinement. You're going to hear folks call it solitary confinement and restrictive housing. It is, in essence, two separate words for the same thing functionally here in Rhode Island. I'll be the first to say that there are limits to litigation. I'm not going to talk about litigation, especially pending litigation today. Representative Felix outlined exactly why many cases advocates are not relying on litigation to advance this, why they are pushing for statutory reforms. And you have seen more and more states that have pushed for statutory changes written into law on solitary confinement in the past few years, including in August of last year, a significant overhaul of the entire New York State correctional system with reforms that actually went beyond those that are outlined in this legislation here, which really stick to national best practices and the recommendations from the Commission on Solitary Confinement in Rhode Island. So the bill is broken into two separate parts. Other folks are going to cover kind of the personal effects on people, best practices nationally, and so on. I want to talk about specifically what this legislation does and a little bit about what it does not do. And it's broken into two pieces. One is the pathways into and the conditions in restrictive housing. And then the second part is a measure aimed at improving transparency to the public. So currently in the Department of Corrections, there are two primary ways that people enter into restrictive housing or solitary confinement. There's disciplinary confinement, which is punitive in response to an offense or a violation of rules. Then there's administrative confinement, which is more of an indefinite status for people whom the DOC believes can't function in general population. So under the current system of disciplinary confinement, there's certain offenses which carry up to 365 days in solitary confinement, which can be stacked to each other. And what the current policy on disciplinary confinement in the Department of Corrections says is that prisoners are entitled to a minimum of 1 hour per day out of their cells, Monday through Friday, with no entitlements on weekends or holidays, no visitation, not even through glass, and a maximum of one 10-minute phone call every 30 days. And that's the current policy on disciplinary confinement. And this legislation would do two major things. One is it would limit the maximum penalty for an individual offense for violation of prison rules to 15 days. And that's not just the number that came out through the Legislative Commission on Solitary Confinement. That's the standard from the National Commission on Correctional Health Care. And it's the current limit from a number of states, including Colorado, Delaware, Idaho, South Dakota, and New York, as it will be implemented next year. This bill follows the Department of Justice best practices for use of restrictive housing from 2016, where it should only be considered for offenses involving violence, escape, or posing a threat to the institution. And if someone continues to pose an imminent threat to general population, to other prisoners, or to staff, after they finish their time in disciplinary segregation, they can be transferred to administrative confinement. And administrative confinement, also in line with the national best practices and with the recommendations from the Commission. Currently, it's an indefinite status, which under current DOC policy carries a minimum of 2 hours a day, Monday to Friday, out of cell. No out of cell time on weekends and holidays. And this bill would increase that from 2 to 4 hours. And that's actually a substantial change for people who are locked in their cells, to increase their out of cell time from 0 to 2 hours a day to 4 hours every single day. And right now it's about 8:30. You know, some of us have been here since 4:30. That's 4 hours. This committee hearing's been going on even shorter. What 4 hours means is that for the other 20 hours of your day, you could still be locked up. You know, this is not a radical change, but it doubles the amount of out-of-cell time that people would be entitled to. And it's really the minimum amount of time necessary that we have seen for rehabilitation, for keeping family connections, for ensuring mental health. It would provide regular placement reviews, and it would help make sure that people with serious mental illness are diverted away from solitary confinement. There are other provisions in this bill that would create transitional housing, more regular assessments, and ensure greater access to programming for people who are in restrictive housing. And then the second part of this legislation would put certain DOC policies under the purview of the Administrative Procedures Act. And under current law, that is the APA statute as interpreted by the state Supreme Court, DOC policies that concern only the management of inmate life, the internal management, are not subject to APA requirements around rulemaking, around promulgation, publishing on the Secretary of State's website. So only policies which involve a third party like visitation or mail or clergy actually fall under APA provisions. And so this second part of the legislation would increase by a really modest amount the transparency that would be required of the Department of Corrections in promulgating policies and rules to implement this legislation, and other policies and rules that concern prison life, including classification, conditions of confinement, and the Code of Inmate Discipline, which are currently agency rules that are not subject to the APA. And I wanted to close by quoting Rick Ramish, who is a former director of the Colorado Department of Corrections, who spearheaded a lot of these reforms that launched some of these changes in the US around 2015 or so. And what he said about his reforms in Colorado was that long-term solitary confinement used to be regularly used in Colorado's correctional system. The problem was that it was not corrective at all. It was indiscriminate punishment that too often amounted to torture and did not make anyone safer. The practice was pervasive because it was considered reasonable and effective. It was neither. Long-term isolation punished people in a way that not only lacked humanity, but sense. And when a program lacks both sense and humanity, the results are as clear as they are disastrous: dehumanization and harm. And that's really all that we're asking for with this legislation, is to bring us in line with what we know works from other states, and get rid of this practice that is harming so many of our community members. Thank you, and I welcome any questions.
Thank you, Natalia. Any questions of this witness? Seeing none, thank you for your testimony.